So pre-op preparation. This is a very important aspect of your pre-op process. You will be mailed a checklist from our office. You have also been given a manual from our office regarding hip replacement or knee replacement. Please refer and read thoroughly through the manual before your surgery. Pre-op medical clearance. This is done by an internal medicine physician who is affiliated with the hospital. Please call the physician listed on your checklist and make the appointment within 2 weeks of your surgery. This is a very important appointment to make sure that you are healthy enough to go through surgery. If you do not have this appointment, your surgery may be canceled or postponed. Pre-op appointment with the surgeon. This is done in the surgeon's office approximately 7 to 10 days prior to your surgery. This appointment is where we make sure we have all the x-rays for your surgery, the procedure will be discussed with you in detail, and plans for your post-operative care will be made. There is also 2 consent forms and a questionnaire in the back of your manual that you will need to sign and bring to this appointment with you. These are the acknowledgement of understanding consent, the blood donation consent, and the 4-page questionnaire. Some of our patients are required to be cleared by a specialist prior to surgery. These include, but are not limited to, a hematologist, a cardiologist, nephrologist, or a pulmonologist. If you need specialty clearance, we ask that this be done early in the pre-op process so that any special testing can be done prior to surgery without any delay. Once you are cleared by the specialist for surgery, their office needs to fax our office or send our office a note specifically saying that you are cleared for surgery. This class is conducted at the hospital. It is not mandatory, but is highly recommended. The classes are during the week for approximately 1.5 hours. These classes are taught by a registered nurse and a physical therapist who are on staff at the hospital. They teach you and a family member on your expectations during the hospital stay and also for going home. They also give you a tour of the hospital floor you will be staying on. Please contact the phone number on your checklist for an appointment. This class can be done at any time prior to your surgery. You may be asked to donate blood for yourself prior to surgery. This blood can be stored at the blood bank and used if you need it after your surgery. Please see your checklist to see how many units of blood that we have requested that you donate. The phone number for the Blood Donor Center is listed on your checklist. Please contact them for an appointment. Blood has a shelf life of 35 days, and the last donation is approximately 1 week before your surgery. So there is definitely a time window of when you can donate blood for yourself. Please refer to the joint manual for the different types of blood donation and transfusions. There are basic tests that need to be done for any surgical procedure. These include lab tests, EKG, and a chest x-ray. The blood and urine tests must be done within 2 weeks of your surgery. There are no exceptions to this. The chest x-ray and the EKG can be done within 6 months of your surgery. Either the surgeon's office or the internal medicine physician's office will send you to the outpatient pavilion on the pre-op day prior to your surgery. That is where you will have these tests done. None of the blood tests that we require have to be done while fasting, so that means you can eat prior to your preoperative appointment. Most patients for total knee replacement stay in the hospital anywhere from 3 to 4 days. For partial knee replacements, they stay 1 to 3 days, and the majority of our partial knee replacements are being done at the surgery center, which patients go home the same day of surgery.